Welcome to PACE YouTube channel. This channel is meant for some of the scientific updates and information with regard to medical field and various diseases. Today I am all with you and I am Dr. Ramesh Parmi. I am a surgical oncologist, that is a cancer surgeon. I am associated with the hospital for the past 4 years. Being a senior, I get to operate on various cancer patients. Today's topic is about thyroid cancers. Most of you know what thyroid is. Just for the information of those of you who do not know what thyroid is and all that. Because commonly I hear patients coming and telling me, "Sir, I have thyroid, I am taking the tablets." Yes, everyone has thyroid. Thyroid is a gland like any other gland in the body. Sorry. There are two types of glands in the body called exocrine glands and endocrine glands. Exocrine glands means those which secrete the things into the body. For example, salivary glands are all exocrine glands. Sweat glands are there, and also sebaceous glands. Intestinal glands are there. Intestinal juice is produced. Gastric glands are there in the stomach, produce gastric juice. All these are called exocrine glands. Salivary glands, as you know, produces saliva, which is the water in the mouth and all that. These glands have a specific function. Because of secretion, there will be digestion of the food, and also saliva facilitates not only chewing of the food but also speech and all that. Dry mouth means you can't even talk well. So every gland has got its own secretion, its own function. These are all called exocrine glands. Now you have another set of glands in the body called endocrine glands. These endocrine glands, the peculiarity is whatever secretions they produce directly into the or release into the blood. For example, saliva is not going into blood, isn't it? But here, endocrine gland, they produce their secretion directly into the blood. For example, thyroid gland today we are talking about, it's one of the endocrine glands. In the brain there is a pituitary gland, which is very important gland. It's an endocrine gland. Adrenal glands are there, in the abdomen, the tummy, they are called endocrine glands. Ovaries, testicles are also endocrine glands because they produce hormones which release into the blood directly. Now, coming to thyroid gland, thyroid is a gland which is like a butterfly shaped. Every human being is born with a thyroid gland. It has got two parts. For example, this is called windpipe. You can see this. This is called Sanskinelli. This is called windpipe. Trachea we call that. Below the voice box. This is voice box, larynx, and this trachea. The thyroid gland is present on the trachea, almost surrounding the trachea, nearly 3/4 in the front part of it. Half of trachea is surrounded with thyroid gland in the front part, and it extends little bit up to the larynx also, not into larynx, just below the larynx. So this butterfly gland evidently has got two parts, the right part and left part, which we call lobes. Thyroid lobes are there, and the two lobes or parts are bridged by a small bridge that is called thyroid isthmus. So thyroid gland is present in the neck. It is present in every human being, and it is present at birth also. Rarely it may be absent or non-functioning by birth. That is called very rare congenital hypofunction of the or less function of the thyroid. Now this thyroid gland being there in adults, its main function is to produce thyroid hormones. Thyroid hormones are called thyroxine, and T3 and T4 they are called. Thyroxine or thyroid hormones, when they are produced, they are very important for not only well-being of the human body but also for so many metabolic functions like growth, temperature, and then bone strength in the female, especially the various symptoms connected to the skin, various features connected to the skin, the smoothness, turgidity, and the texture of the skin, and then the body temperature, and then digestion and metabolism. All these are directly or indirectly related to the thyroid hormones. Now, having said this, thyroid gland also can be a victim of cancer. Cancer can develop any part of the body, as you know. Cancer can develop in salivary gland, in the brain, in the breast, in the intestine, where not, and also in thyroid gland. So thyroid cancer is the topic of interest today, and commonly and truly hypothyroidism. They say I got thyroid, Dr. Saab. That means they have got less function of thyroid, which is called hypofunction. More of thyroxine or thyroid hormone is called hyperfunction. So the thyroid hormones which are very less secreted, they are called hypothyroid, which is a very common problem in most of the age groups. Almost about nearly 20 to 23% of population in some parts of India especially are afflicted with this problem called hypofunction. Less thyroxine produced. Once this thyroid gland is not able to produce enough thyroid hormones T3 and T4, then there will be some stimulus to the gland to produce more and more. That is called TSH hormone, thyroid stimulating hormone. This thyroid stimulating hormone is also a hormone like thyroid hormone, but produced in the pituitary and, as I said, into the blood. This TSH travels to the thyroid gland and stimulates the thyroid cells to produce more of this hormone called thyroid hormones. When the thyroid is not functioning well, evidently more and more TSH, thyroid stimulating hormone, is produced from the pituitary to stimulate the thyroxine production in the thyroid gland. So when they do thyroid tests and the TSH is high, that means the gland is not functioning properly or up to the mark. There is hypofunctional thyroid gland. So this is the common problem. The next common problem is a small swelling or lump in the thyroid gland, either one side or other side. That is what is called a benign tumor, probably adenoma, which may or may not secrete thyroid hormone. On the other side, there may be, on the other side, there may be increase of the thyroid gland per se. Not only one nodule or one lump or swelling, but both the lobes or both the parts, the right and left part of the thyroid gland may increase in size uniformly. That is called hyperfunctioning thyroid or goiter or what you call Graves' disease. In all these diseases, more of thyroxine is produced because of the diffuse enlargement, complete enlargement of the thyroid gland, not one lobe or one nodule. During this process of growth, evolution of human being, there will be ups and downs in the growth and metabolism. To meet all these requirements and demands of growth by physical growth and also mental growth of a human being, different levels of thyroid hormones are produced in different age groups. This is called hyperplasia involution cycle. To produce more hormone, the thyroid gland cells or lobules increase in size. To produce less, they become quiescent, and the cells are filled with what is called colloid, which is a non-functioning or not hormone. So this kind of hyperplasia, increase in size and increase in number of cells, and involution, that is regression in the size, is a cycle that goes on, and that may be the reason why you find goiter in the adults or swelling of thyroid, which can be differential. Some of these swellings or lumps can be malignant, that is called thyroid cancers. So thyroid cancer, the exact reason is not known, but it is seen that when there is hyperplasia involution cycle happens, because of the stimulation, what happens, some of these nodules, so-called regenerating nodules in the thyroid, may become more and more active, divide, that may become a lump which is not of any use at all. Thyroxine is not produced, but it is increased in size. That is called unregulated growth of the thyroid cells or thyroid gland, increase in size but of no function or usefulness to the body. So this is the commonest called a small single nodule or slowly growing nodule or lump in one part of thyroid, commonest presentation of a thyroid cancer. The other reason is, apart from the hyperplasia involution cycle, which is a physiological process in the human body during the growth, there is another aspect called irradiation. If a human being, if a man or woman is subjected to, or even a child is subjected to radiation, for some indication is there, either cancer in the head and neck area where they irradiate. Once the irradiation or radiation takes place, there is ample evidence that a good percentage of these individuals may develop after 10 or 20 years thyroid cancer. So one of the other causes of thyroid cancer is exposure to high energy rays or radiotherapy, radiation, external beam radiation, EBRT, in the childhood or 10 years, 12 years before the development of the cancer. Other rare causes are there, like endocrine neoplasia, there is called MEN, multiple endocrine neoplasias, where these endocrine glands develop hypertrophy or hyperplasia and also anaplasia, that is cancer, in due course of time in multiple glands. So, including there may be MEN means pancreatic endocrine tumors along with thyroid tumors, that is called medullary carcinoma thyroid. So, having said this, there are mainly 4 types of thyroid cancers called the papillary cancer or carcinoma of thyroid, the follicular variant of carcinoma thyroid, or the undifferentiated or anaplastic or poorly differentiated thyroid cancer. Lastly, there is what is called, as I said, medullary carcinoma thyroid, which is part of the multiple endocrine neoplasia MEN syndromes, where there will be cancers in different parts of the body, in different glands, especially endocrine glands. This is the in short about the etiology and various types of cancers. Cancer thyroid in one way is a good cancer compared to other cancers, especially the papillary variant and the follicular cancers. Of course, the anaplastic variant or the undifferentiated thyroid cancer is of course very aggressive, and the results also may not be very encouraging. But other types of cancers, when properly attended, treated, they are got very good prognosis. The 10-year survival and cure rates are very good in these cancers. So, papillary carcinoma thyroid, which is nearly about 25% of all thyroid cancers, develops typically in young individuals, maybe between the 3rd and 5th decades, and more in women than in the men. Probably again, having said that, the hyperplasia involution cycle of thyroid gland is subject to a lot of hormone stress in females because of the menstrual history, menarche and other things. That could be one reason, including pregnancy. So, all these stresses, physiological and otherwise, also demand more of thyroid division, increase in size. During this process, something may go wrong genetically, producing what is called a useless lump or swelling called the cancer. Follicular cancer is also a type of cancer of thyroid which can occur in existing thyroid hypothyroid gland and also develop part of the as a combination of the papillary variant. So, these papillary, follicular are nothing, you need not be worried about that. They are more like pathological varieties which are of medical importance rather than clinical importance. The only thing here is that papillary cancers can be treated conservatively, including subtotal or not even complete removal of the thyroid gland along with some of the lymph nodes. So, wherever there is a cancer, as you are all aware, that treatment will be removal of that organ which has got a cancer. Crudely speaking, though it is not true always, breast cancer generally entails or calls for removal of the breast. Intestinal cancer calls for dissection or removal of a good segment of intestine. Like that, what I said, testicular cancer calls for removal of the testes, ovarian cancer calls for removal of the ovary, the uterus and other things. Having said this, the lymph nodes are also removed. This is all because whenever there is infection in the hand, there may be a gland developing in the axilla. Whenever there is infection in the foot, there may be a gland developing or swelling developing in the groin. These are called lymph nodes. Similarly, cancer in thyroid can spread to lymph nodes in the neck. That's why along with the thyroid gland, the lymph glands are also removed. That is called total thyroidectomy with the anterolateral block dissection of the neck. Well, I have come in a different way. I have talked to you about the treatment of cancer of thyroid first rather than talking anything else. I know you must be wondering how does you suspect or diagnose the cancer? When do you like to go to doctor like me for clearing your doubt if you are having a thyroid cancer or not? Generally, there won't be any major symptoms in case of thyroid cancers. The only symptom is that there is a kind of fullness in the neck. In front of the neck especially, there is a small lump coming out, which may be slow growing in case of papillary and follicular type of thyroid cancers, which may be a bit rapidly growing in case of anaplastic cancers. Medullary cancers of thyroid also present with a small swelling or lump in the region of the thyroid in the neck, in front of the neck, that is in the region of the trachea windpipe. So, this is the commonest presentation. As the swelling increases in size, there may be what you call mild shiningness of the skin. The skin gets stretched and its skin becomes shiny. there may be more prominent veins, blood vessels may be seen in the neck in that region. Sometimes the gland is burrowing back into the backward area, that is between the windpipe and foot pipe. There is what is called the recess into that interval between the foot pipe esophagus and windpipe trachea. Trachea is in the front and foot pipe is behind that. Thyroid cancers can also grow into it and cause difficulty in respiration, that is called involvement of the trachea, windpipe. Sometimes they get cider and cough, and then there may be change in the voice also. And then there may be what is called difficulty in swallowing, that is called deglutition, not able to swallow well and all that, because there may be pressure on the foot pipe, which is very proximal, very close proximity to the thyroid gland and trachea. So respiratory symptoms, food swallowing symptoms like deglutition problems, speech problems, increase in the size of the gland, some swelling or lump appearing in one side of the neck which is slowly growing. There may be mild stretch of the skin with prominent veins. Rarely there may be mild pain in that as well. These are some of the common features or symptoms presentation of thyroid cancers. So any difficulty in talking, especially hoarseness of voice, one has to see and rather rule out the presence of thyroid cancer, which can be a cause of hoarseness of voice because of the pressure on the nerve which supplies the voice box larynx. It's called recurrent laryngeal nerves. Having said this, the other presenting features are some lumps in the neck. These are called lymph glands, as I told you. In the front of the neck and the side there may be small swellings coming up, lymph glands. There are about 240 lymph glands in the neck, in the both sides, in different regions of the neck, up, middle and low. And these glands might enlarge in size because of the cancer in thyroid. They may be present along with the thyroid swelling. Sometimes, funnily, they may be present but without any evidence of swelling or lump in the thyroid. It's called occult, hidden primary cancer with thyroid, which has already spread to the glands. So these are the common presentations. So we have discussed now what is thyroid cancer, why it occurs, what is the common presentation, what is the treatment. Having said this, what is the normal risk? The thyroid cancers are small in number. They are they account for about 8 to 10% of all head and neck cancers. 8 to 10% of head and neck cancers include lymphomas, cancer of the cheek, cancer of the lip, cancer of the tongue, various lymph glands and parotid gland or salivary gland tumors or cancers. All these put together, about 8 to 10% of head and neck cancers occurring in the head, including brain and also neck. These are called head and neck cancers, and they account for about 8 to 10% of all the head and neck cancers are thyroid cancers. And medullary cancer thyroid requires not only surgery but also different type of treatment depending on the various immunohistological factors or tumor markers. That is a different entity, and also details are not warranted here. It will be more for medical professionals. Now, cancer means we are worried about two things: that it may prove to be fatal, and secondly, it may spread elsewhere. Yes, thyroid cancers may not be fatal compared to other cancers, but they do also cause death indirectly by pressure on the or engulfing or encroachment onto the foot pipe as well as respiratory tract, that is trachea, the windpipe. Now, they also spread to various regions. These are called local spread, as I told you, into the trachea, into the foot pipe, into the skin, into the voice box. Regional spread into the lymph glands. Various sites of lymph glands are present in the neck, level 1 to level 5. These are all the lymph glands which may enlarge, and this is called regional spread, and they also spread to distant organs. Systemic spread, otherwise called metastasis. These are present in the bone. Thyroid cancer is known to spread to the bones, especially the follicular variant, where the bones get weakened because of the deposits of the cancer cells going there through the blood. They deposit there, they erode the bone, and bone may become weak, especially the spine, backbone, the humerus bone in the upper arm, and sometimes the ribs which are in the rib cage. These are the common sites of cancer of the spread to the bones as far as thyroid cancers are concerned. Treatment is, as I said, mostly surgical. Sometimes necessary after surgery, we also give what is called radiotherapy in the form of radioactive iodine. Radiotherapy can be given with an external beam like a conventional method, as you might have heard, for the bone metastasis or somewhere. But the radioactive iodine is an isotope. This radioactive iodine I-131 and I-132, these are the isotopes of the element iodine, and they are very active. They is taken up by the cancer cells avidly, and because of the radioactivity emission, the high energy rays released there locally, the cancer cells would die. So after thyroid surgery, you might have seen some doctors advising to wait for 1 month. Then they see what is the TSH level. TSH suppression is called. Then they may ask you to go for a scan and see if there is residual lesion. Depending on that, they may ask you to go for radioactive iodine therapy also. Otherwise, it is what is called only surgery, followed by hormone replacement. Once thyroid gland is removed completely, thyroid gland, one may have to go on lifelong thyroid tablets, that is called thyronam or thyroxine tablets. These are given depending on the requirement, 1 month or 1.5 months after the surgery, where completely the gland is removed and there is no disease elsewhere as decided by the scan. There may or may not be requirement of radioactive iodine therapy. Some cases, rarely, which is inoperable, they may give only radioactive iodine therapy to suppress the disease, to contain the disease, but that is not the total cure. For all solid tumors, please remember, surgery is the best option. Well, I think somebody has expressed a small doubt how to diagnose thyroid cancer. If I am not mistaken, a few things I covered. The patient generally presents with a small swelling in the front of the neck, commonest presentation. When it is advanced, there will be, of course, symptoms pertaining to foot pipe and voice box and also windpipe. So the way to diagnose is, after examining the patient clinically, that is bedside, the doctor confirms that there is a swelling in the thyroid, one side or both sides, and that the particular side they take X-rays and also scans to see that it is coming from the thyroid. Then they do what is called FNAC, fine needle aspiration cytology, is a very common test done. Once it is done, we will know through a drop of blood or secretion taken from the gland, that lump in the gland or the swelling in the gland, we call the nodule. We spread it on various slides and look under microscope after staining. So the cells will be very typical of cancer cells, which are a little different from the normal thyroid cells. When the cells, cancer cells of thyroid resemble normal cells of thyroid very much, but for in mildly differentiation, like nuclear, cytoplasmic ratio and all that, they are called well differentiated. When the cancer cells do not resemble the original thyroid cells at all, they are called undifferentiated. So there may be well differentiated, moderately differentiated or poorly differentiated thyroid cells, cancer cells. Depending on that, they name the cancer. So this is one way. Other scan is also available. Apart from the ultrasound scan, there is what is called PET scan. One can do a PET scan, positron emission tomography of head and neck and chest, to know the type of tumor, that is malignant or not, or is simple adenoma. Depending on the FDG uptake, that is called again isotope uptake, glucose isotope uptake, deoxyglucose uptake, it is rated as cancer or not. That is another thing. There is what is also available called per-technate scan or CT scans. Not only iodine I-131 scan, but also per-technate scan. Technetium 99M is also an analog of technetium or isomer. This scan also gives features of cancer of thyroid vividly, not only in the head and neck region, but also elsewhere if present. In the bones also it is diagnosed if it is present already in the bone, stage 4 disease and all that. So various clinical examinations, ultrasound scans, and then the fine needle aspirations or true cut biopsy if necessary from the thyroid tumor. Then the PET scans, apart from sometimes CAT scan they see and also decide a PET scan is better. Then there is what is called per-technate scan, CT scan, thyroid specific scans. These are called I-131 scan and also this radioactive iodine scan and also per-technate, technetium 19M, Systemiba scan. These are all the various modalities available to diagnose. FNAC, biopsy are the ultimate features or authentic evidence to say that there is cancer in the thyroid. Depending on that, the treatment protocols are applied, and remember, cure rates are very good in this. Thyroid cancer is one of the best cancers and very much curable cancer mostly.